Go ahead.
Okay. Good afternoon, everyone. Special welcome to persons on the YouTube channel and more so on the Zoom. This is indeed a pleasure to be here. I am Charlene Marshall Davis, your host for this afternoon. And I am sure this afternoon going to be a very, very good afternoon. Also based on the topic, I know it will benefit all of us. And so at this time, I am just going to just ask you all to do little activities, very, very short, and I would say out of the box. Can persons hear me? That is important. Hello, can someone open their mic and respond? I need to know that I'm
Yes,
heard.
we are.
Oh, wonderful. So this is our Omega Kappa fourth webinar at infection prevention and control webinar, which also involves non-nursing hours. And it is indeed amazing for this opportunity. And I am really thankful for the persons, because without you being on the platform, then it would not be worth the while. So my little activity this afternoon it's fairly simple. I'm going to just ask you to, wherever you are, close your eyes, and you're going to behave like a little baby this afternoon. So instead of, when we notice when we have our little babies and you hold them up, they are trying to reach our eyes, the orifice, like the eyes and the nose and the mouth. So this afternoon, you are going to be that baby on yourself. And then when you're through, you can tell me how you feel by just doing that. So close your eyes, use your right hand to reach out, caress your face with your hand, reach to your eyes, your left eye, then your right eye, then your ears, and then your mouth. Okay. Have you heard that? Have you heard what I just said? Are you hearing me?
Yes, we are, Madam Moderator.
Okay. And just a reminder, remember, in order to have your certificates, you must sign in with your correct name, because if whatever name you sign in with, it is not other than your correct name is not acceptable. So we don't want to see an iPhone or a AJ phone. We need to see your complete correct name. All right. So let us go ahead now with that little activity. You remember, anyone want to repeat what I said for the benefit of those who wasn't hearing at the moment? All
Yes,
right.
please.
Okay. I'm waiting to hear.
For the repeat of the instructions.
You're right. Or should I call on someone? As my madam, I'm sure normally say with her students, when she don't get them to participate, she voluntold them. So do you want me to voluntold? I'm stealing something from her this afternoon. So I'll give you another moment to volunteer to just say the instruction so that we are clear on the instruction that was given. No taker? Well, I see a few names in front of me, and I'm just going to call on one. Miss Gillian Blair, do you want to repeat what I just mentioned? Repeat the instruction?
Sure. Good
Thank you
afternoon.
so much. Good
Good
afternoon.
afternoon. The instruction says you should close your eyes, and we're using our hands to caress our orifices, our eyes, our nose, the mouth, and the ear. So you use your left hand, no, your right hand to caress your left ear and vice versa. So that's what I understood.
Thank you very much. You are correct. So it's your face. The whole thing is your face, and the orifice is on your face. We can start now because we don't have the whole afternoon. So I'll give you a minute, and then one or two persons can respond to say how they feel. Okay, so you're now going to do same. It is now 4:38. Okay, go ahead. Okay, it's now 4:39, and I need someone to respond. As I said, about 2 or 3 the most persons to respond to that instruction. How did it make you feel? As I said before, normally when you hold up a baby, they are doing that to you. So doing it to yourself now, how does it make you feel? All right, I'm not going to volunteer this time. I want you to volunteer. It's a democratic country, right? Okay. Persons on the YouTube, you heard?
Yes, they said they're hearing you clearly.
Wonderful. Thank you very much, Madam P. So we can have one from YouTube responding and one from, I don't have any prize for you. The prize is just how you will feel. That's the prize for this afternoon. Pampering yourself mildly. Okay, who is the taker on Zoom platform? Remember, we don't have the whole afternoon. Okay.
Sister Davis, I just logged on. I'm saying the Mulrains, but I didn't hear the what we're responding to.
Okay, so it's just a little exercise to say, just like a little baby, when you hold the baby in your hand, the baby, depending on the age of the baby is reaching for your eyes, touching your face and so on. So I just want persons to do that exercise where they will use the right hand and caress their face, touching their eyes and their ears, and eventually their mouth. And tell me, how did that make you feel?
It's a relaxing feeling.
Thank you. Okay. Okay. And one from the YouTube channel. Any response?
Not yet. It takes them a little while, but we can go ahead until they type it in the chat over there.
Okay, okay, okay. All right, the second taker from Zoom. So one from YouTube and two from Zoom. So Mrs. Mulrain had responded. It makes her feel, it felt relaxing. Any other person? Don't be shy, man. Don't be shy. It's now 4:42. So if I'm not getting any more taker, can I just go ahead, Madam P?
Yes, you can.
Okay. All right. Well, I guess it's sufficient for the person who responded that it felt relaxing. And this afternoon, we are looking at, we have two persons to present. We have our secretary, Mrs. Sandra Chisholm Ford, and also Mrs. Cheryl Garrix Lloyd, who will be doing their presentation for the non-nursing aspect is 2 days of non-nursing. Today is the first one and tomorrow will be the second one. So the topic that Mrs. Chisholm-Ford will be sharing is bullying in the workplace. So Mrs. Sandra Chisholm-Ford is a registered nurse, registered midwife, and a public health nurse who currently lectures at the University of the West Indies School of Nursing, Mona campus, where she also obtained her Master of Science degree in nursing education. She is an active member of the Omega Kappa chapter of Sigma Theta Tau International and member of various professional organizations, including Caribbean Network of Nursing and Midwifery Educators and the Nurses Association of Jamaica. Mrs. Chisholm-Ford has been working in the field of nursing for over 20 years and has been consistently involved in community development through her passion for volunteering. She is a member of the Unison's Friend of Mona, engaging in outreach activities at the Mona High School, a board member of the Seaview Gardens New Testament Church of God Basic School. She mentored students at several primary and high schools. For the past 19 years, she has been conducting wellness activities as well as providing maternal and child health services to over 400 citizens of the Whitfield Town community on a weekly basis. That is so awesome. Aside from her talents and advocacies, Mrs. Chisholm-Ford is also the author and co-author of several publications. So there is a challenge this afternoon with her camera. So please accept her as she is at this time. So help me welcome Mrs. Chisholm-Ford as she explore the topic of mental health in the workplace. All right, just use your what you call it now? What is the right word? Your little clap, put up your clap and forgive me not remembering the exact word to use at this time. And Mrs. Chisholm-Ford, it's your turn now. Thank you very much as we listen attentively. Oh, I am going to introduce Mrs. Garrix-Lloyd at the same time. Sorry about that. So I'll go on to her. And then Mrs. Chisholm-Ford will come on at the end of the introduction of Mrs. Garrix-Lloyd. So Mrs. Garrix-Lloyd is a registered nurse by profession. She completed additional nursing duties in psychiatry, nursing administration, and a Master of Science in nursing education. She worked at the bedside for a combined total of 15 years before transitioning to teaching in 2014. She is currently a lecturer at the University School of Nursing Mona. Her other professional and volunteer activities include being involved in nursing organizations locally and internationally, being president of the St. John the Baptist Kinder Preparatory Home School Association and participation in 2 groups in her church. She is an avid mental health advocate and is currently pursuing PhD studies focusing on positive mental health. Her most rewarding job, however, is being a wife and mother to 5 lovely children, young people. So having done both the bias, we can now help me welcome Mrs. Chisholm-Ford as she explore the topic bullying in the workplace.
Thank you very much, Madam Moderator. Just one quick
Yes.
second before Mrs. Chisholm-Ford starts. We have a Camille in the session. Colleagues, you are being asked with the instruction when you click the link to join to please join with your full name or you won't be allowed in the session. Might I ask my colleague Camille to rename herself with her full name or she will not be able to stay in this session? Thank you, Mrs. Chisholm Ford. Sorry about that.
That's okay. Thank you very much, colleagues. Pleasant good afternoon to everybody. And welcome. Thank you for joining us here at Omega Kappa Chapter's Infection Control Prevention and Prevention webinar series. And we, as Omega Kappa, we are always pleasured to serve you. Today, I will be looking at the topic bullying in the workplace, and I'm sure many of us can identify with this phenomenon. Please let me know if you are seeing my screen.
Yes, we are.
Thank you very much. So I'm sure my bios told you I'm a teacher, so I will of course start with my objectives. So we will be defining bullying this evening, defining workplace bullying, looking at the different types of workplace bullying, determining how does workplace bullying occur, what motivates the workplace bully, and what types of people are at risk for being targeted, as well as what are its effects on victims, observers, and businesses. We will also look at what can be done about it and how can social change agents help to combat the problem. So of course, all of us, I'm sure, have a workplace, and we can all identify with this definition that the workplace is a place of employment where people perform tasks, jobs, and projects for an employer or their employer. So now, what do we consider to be workplace bullying? Of course, if your workplace is a place where you perform tasks for your employer, workplace bullying would happen in that place, so you would have workplace bullying. So it's a persistent pattern of behaviors that threaten, intimidate, degrade, undermine, embarrass, or humiliate another and have an adverse impact on another's emotional and psychological well-being. It is also harassing, offending, socially excluding someone or negatively affecting someone's work tasks. What are some examples of workplace bullying? Spreading malicious rumors. And while I am doing this presentation, I'm sure all of you are thinking about instances where you may think you were bullied, or you were actually bullied, or even remember instances where maybe you were in fact the workplace bully. So if there were instances of spreading malicious rumors, gossiping, undermining, or intentionally impeding another's work, blaming or unwarranted criticism without any real justification, excluding or socially isolating another member of staff, excessively monitoring, micromanaging, and unwarranted punishment of persons in the workplace, blocking training, blocking leave, blocking promotions. These are all examples of workplace bullying. And of course, my screen decides to freeze. Okay. So who are most likely to be victims of bullying? Someone who is eager to please. In our word, in our jurisdiction, we would call them the yes men. Anybody who is non-confrontational, usually the very quiet ones who will avoid arguments if people tend to put them forward. Or persons who normally feel that there's a threat to their authority are likely to be victims of bullying. Bullies tend to bully because they have identified a person that they think is weak and they want to wear that person down. They themselves feel threatened about their job and they want to ensure that the person that they bully do not threaten their job security. Bully when they want to get a promotion or to go on a course. They bully when they want to ensure that the know that they are in charge and they are more powerful than they are. And they also bully because they want to instill fear in others who are not being bullied. So if you see me bullying this person, if you ever mess with me, I will do the same to you. These are the reasons why they bully. What are some of the behaviors that bullies display? They may unduly criticize the work of others. There's nothing wrong with the person's work, but they find fault with it nonetheless. They make false accusations. And in simple terms, tell lies on the person. Persons will do the work and the work is good. They will steal the credit for the person's work, say that they were the ones who did it. And some of these people don't even realize that these kinds of behaviors are really bullying behaviors. By denying training or resources for success, if a person needs to do an in-service course and they're not being sent to go because they can go and they are just being denied because you can deny them, then that is bullying. Uninvited invasion of office space and scrutiny of emails. And this is really rather concerning for people to really want to go into people's emails to see what is happening. And if you go into a person's space, office space, that little area that is designated to be theirs, that is bullying. When you interfere with the work of others so that they can't get to function properly, when you shout or yell at others, when you make past insults, when you are in a group and someone is talking and you actively ignore or exclude the person. Such as, when you down or you talk when they people lies, malicious rumors, or gossips about a person. When our policies and office, the bully, different policies, standards to that particular person who is being bullied. Find that tend to impose unreasonable or inappropriate ask personal things able to intent is also examples of
Mrs. Chizamfor,
well,
you're going in and out.
colleagues, are you hearing me?
Hear you, but as Mrs. Lloyd said, you're going in and out.
Yes, I just realized it said that my connection is unstable. So I'm actually moving to a better place.
Okay.
Are you hearing me better now, colleagues?
So far, now we are hearing you better.
Awesome. Thank you very much. So how do we know that we are being bullied? So we need to look for these signs. If you have a boss or employer, supervisor, or a colleague, and they always find fault with your work is never ever good enough for them, then that is one sign that you may be bullied. If your colleague, supervisor, or boss makes you feel humiliated, then that is another sign that you may be bullied. If you constantly feel anxious and agitated at work, and of course, when it comes to Monday morning, when you see Sunday evening and you know you have to go to work Monday morning, you can't even fathom going back to work. You dread when the new work week starts. That is also a sign. When your coworkers are no longer socializing with you. And this can be looked at in two ways. Is it that you are at fault, or is it that you're being bullied? When someone is constantly interfering with work that you're trying to do. So you're trying to get stuff done, and if you have a particular set of tasks that you must complete within a certain time, and people keep adding work to it so that you aren't able to meet your timelines, that is also a sign that you are being bullied. If they yell at you or shout at you in front of others, and if you shout back, you are punished. Of course, this is another sign. Human resources or other supervisors or so on in the area says that there's nothing they can do about the bully's behavior. That is also cause for concern. If your request for transfer to another location is being denied, that is also cause for concern. If you're constantly feeling stressed about work, even when you're at home, if you feel exhausted on your days off and very uninterested in activities you once enjoyed. And I know I'm reading all of this and everybody's saying, oh God, that's me. Oh God, that's me. Yeah. If your family suggests that you leave work at work and your doctor also asks about what you could be doing that is making you unwell, it means that your workplace is impacting your health, and it's generally due to bullying. When you start to think you somehow caused the bullying, when you start to blame yourself, to say, I guess it's because I don't do things right, why they have to do this to me. Of course, you are actually being bullied. So bullying is not healthy. It is very negative and it affects your productivity. It can cause legal woes. You may have to sue somebody. You may get in trouble. Somebody may sue you because you may react in a negative way. Sorry, there's increased turnover, job turnover. People are leaving the workplace because they are unable to stay because of the bully. When there's increased absenteeism, of course, when people keep getting ill because of the effects of the bullying, they will have to be going to the doctor more often. So of course, there will be increased healthcare costs. The workplace will be very negative. Nobody at all in that workplace will be healthy enough and productive enough. There are also other unhealthy consequences that may spill over into your home lives. There is poor relationship with your co-workers. You are not at all satisfied with anything that you do. And of course, resignations are on the rise. Some of the things we believe about bullying that is not true. We believe that people who are bullied at work are always the ones who are vulnerable, weak, or thin-skinned, and that is not true. People who are strong and level-headed and can defend themselves and intelligent are also bullied if the bully feels that they are a threat to their existence. Persons who are competition may not be bullied. Are only only persons who are competition will be bullied. No, whether you are competing with someone or not, they will still bully you. Persons who are go-getters cannot be bullied. That is not true. As a matter of fact, the envy of the bully will cause them to bully you. Persons who are high performers and persons who are well-liked are also the ones who are bullied, despite people thinking that those are the ones who may not bully. There are 3 types of bullying. We have the top-down bullying, we have horizontal bullying, and bottom-up. Top-down is where the managers, supervisors, and so on bully persons who they supervise or their subordinates. Horizontal bullying occurs among peers when co-workers on the same level bully each other, and the bottom up. And many people didn't believe that could happen. It does. You have subordinates who bully their supervisors or managers as well. There are things that the workplace does that facilitates the bullying, and that persons need to recognize them so they can prevent the strengthening of bullying. When the workplace is ignorant of an issue, it may cause the bullying to continue. So when you suspect or you think that you're being bullied, you need to speak up so that persons in the workplace are aware that you're being bullied. If the bully is known and is being supported by members in the workplace, that also continues to strengthen the bullying. There are managers who are sometimes implicit or complicit with the bullying. Either they do things that will make the bully you more, or not do anything at all, and that will cause the bullying to think that they are free to continue with their negative behavior. When workers are stressed, if the workplace is a high tension, high stress workplace, employees who are stressed will become frustrated. Becoming frustrated makes you want to take your frustration out on something or someone. And generally, the taking out of that frustration comes out as bullying. So workplaces need to ensure that the stress level among employees are at a minimum or nil. If the workplace has no system where workers can report behaviors that are threatening or bullying, then the bully will continue. So if they can't report it and there's no protection if they report it, then the bully system will be permeated. If there is no anti-bullying laws, there are anti-bullying laws worldwide, but the workplaces need to recognize them and implement them in the workplace. Persons who are being bullied react in different ways towards the bully. The person who is being bullied or the target may accept the bullying behavior as part of the employment. It's all right, it's so them stay, and we can't do nothing about it. And that is not acceptable. The target, again, fearing retribution or losing their job, will leave it alone. Also, approximately 75% of the persons who are being bullied end up leaving the workplace. Generally through resignations, or sometimes they may get a transfer to another area if it is allowed. This is one of the things that is becoming very, very popular, cyberbullying. people using social media and the internet and the internet space to attack the persons. Cyberbullying occurs in chat rooms. It can be in the form of text messages, emails, spoken words, instant messages, and so on. So, with increased internet use, bullies are now sharing photos and conversations and starting vlogs and blogs and generally spreading lies through conversations with hundreds or even millions of persons. And once these things go out, once these things go out into social media, they can never be retrieved. So examples of cyberbullying, as I said earlier, malicious or threatening emails or texts, emails that contain offensive images, jokes, or comments, emails correcting an individual that was copied to a group. Any of those can be seen as cyberbullying. So colleagues, if you are the bully, please modify your behavior. And if you are a target, you need to identify the challenge and seek help. Workplaces can prevent bullying, especially cyberbullying, by implementing a cyber policy. They can add a cyberbullying section to the hospital or workplace policy. They can provide training for staff and management in dealing with cyberbullying. They can also give examples of what is cyberbullying, because a lot of persons may not even be so sure that what they are doing is actually cyberbullying, especially when it comes to replying to emails. So I, for one, I avoid clicking the reply all when I'm replying to emails. Because sometimes when you reply to an email, someone in the reply all may find it offensive. So unless you want everybody on the email to hear or to get the message that you're sending, you don't have to reply all to every email. You emphasize that employees do not write anything they wouldn't say in person. And that is important. Reminding staff that anything posted on the internet is there forever. And I just said that. Once it goes out there, it remains there. And a lot of workplaces can consider blocking these social network sites, the Instagram, the Facebook, the Twitter, the other ones. They have some other secret ones that persons use. Blocking them on the workplace computers will help with cyberbullying in the workplace. Managing the bully in the workplace. There are 3 levels of intervention in managing the bullies. You measure there is the informal intervention, the awareness intervention, and the authority intervention. And we have 3 persons who are impacted by the bullying behavior. We have the bullies themselves, we have the victims who are the main, who are feeling the brunt of the bullying, as well as the observers. So all 3 should look at first at informal interventions. So the conducting of interviews to discuss events, to listen to the responses. So you will ask for a meeting with the bully. So the bully, and we always recommend that when the victim is requesting the meeting with the bully, they ask for someone who is neutral, which is an observer, to sit there so that it minimizes the risk of the bullying behavior to persist. So in that meeting, the All parties are expected to discuss the events, listen to the responses, and as well as give their perspective. So the bully will get an opportunity to say why they feel the need to bully persons. The victim will state how the bullying behaviors makes them feel, as well as the observers are able to verbalize how witnessing the bullying behavior impacts them. Then there is the awareness intervention. This awareness intervention is where the management of the area compiles all the complaints of the bullying and uses it to create, to do an epidemiological statistical graph and present it to the staff to say, this is what we are experiencing. This is the percentage of persons who are being bullied. This is the percentage of persons who are bullies. This is the impact that the bully is having. These are the number of persons who have left this workspace because of bullying. These are the number of persons who will never come because they hear that we have bullies here, and so on. So the awareness will help the bullies to tone down their bully behavior or desist from bullying. You also have the next step, which is the authority intervention. These interventions are generally implemented by management as well, that contains and consists of training and specific counseling sessions for both, for all three, for the bullies, the victims, and the observers, so that persons can benefit from the interventions. The main persons, though, that these interventions are geared towards are the bullies, and the expected outcome is for them to improve their behaviors. So the manager of the unit is mainly the person who should implement these anti-bullying strategies. Oftentimes, though, the managers are the bullies. So if the manager is the bully, you would go above the manager in order to get these interventions implemented. So we provide conferences or workshops to educate and empower the members of the team, all workers in the workspace. You want to create and enforce a zero tolerance anti-bullying policy, as well as to determine and enforce possible courses of action for bullying behaviors. So the bullies will, at number 3, understand that if the behavior persists, you will be suspended without pay, or if it is so severe that we are losing our staff because of you, we may need to let you go. We will also, the manager should also be promoting and endorsing the anti-bully legislations that are available within the country's constitutions. We expect the worker to never become a bully under any circumstance. It is never good. We also expect the worker to recognize when they are being bullied, realize that they are not at fault, and of course, alert management immediately when they feel that they are being bullied. They are also asked to ensure that they find witnesses, and these witnesses are asked to testify that they have observed the bullying, and of course, they should also testify as to how those bullying activities impacted them. So bullying has a lot of impact on the individuals who are being bullied. So the psycho-emotional impact of bullying includes increased stress and anxiety, increased incidence of depression, increased shame and guilt, helplessness, and we have increased locus of control. We have lower self-esteem and self-efficacy, anger and aggression, as well as suicidal behaviors. How does bullying impact the sympathetic nervous system? When a person is being bullied, it releases hormones that interfere with the functioning of the prefrontal cortex, which is responsible for executive functioning. So, what does this mean? It means that when you are being bullied, you are no longer able to plan and organize and do your work in a sequential and organized manner. The bullies tend to turn your brain upside down, so you are now disorganized and confused. And you would not believe that it does, but it has a very negative impact on your sympathetic nervous system. How it impacts your physical health. Of course, your immune system is going to go haywire. Your blood pressure is going to go up. You will start having impaired glucose tolerance, weight gain due to hormonal imbalances, weight gain or weight loss. Of course, you're tired because of the mental drain. It causes you to feel fatigue and tiredness, headaches, nausea, chest pain, and or cardiovascular disease. Many of the victims respond different ways. Some will say, when you ask them about the bullying and how they feel about it, they will say, well, there's nothing really wrong. I don't feel any way. When they do, they're really having the physical and sympathetic nervous system effects of the bullying. They will say, I can handle this, when they really can't and they really need the intervention of someone else. When they're saying it will be okay. So today I wasn't bullied, so all is well. The bully may not bully you today, but rest assured they're going to come tomorrow. The victim may also think, okay, it is going to stop. If I ignore him or her, it will stop. It will stop eventually. Let me not pay it any mind. And sometimes when they complain to people, observers will tell them, no pay him any mind, him soon stop. Victims may also blame themselves and say that no one will believe them, so they will not report the bullying. They will not, because they believe that other persons in the workplace who may be friends with the bully may ostracize them because they're friends with the bully, or because they believe that the victim is too soft and not standing up for themselves. The victim may also think that they will be humiliated by reporting the bullying incidents. And if they do, the bully will attack them more, or they may lose their job, especially if the bully is their boss or their supervisor. Regardless of what you feel about bullying, you need to stand up for yourself, regardless of who is bullying you. So if you are being bullied, if you are a subordinate being bullied by your supervisor, if you are being bullied by your peer, someone on your same level, if you're a manager being bullied by your subordinate, stand up for yourself. You tell them explicitly they are not to speak to you in that manner unless you are in another capacity and you are asking them to do so. You're going to you're going to ensure that the communications are professional and they are what the company requires. So you are sending me an email, you address me, good afternoon, good morning, good evening, or dear so and so and so. You do not just send an email with no subject or no greeting. That is bullying. You identify other persons in the company who are also being victimized and bullied by that person, and both of you can come together, or if it's a group of you, come together and write the report that you're going to be making about the bullying activity. If the bully is your boss, determine whether you can live with it, or you ask to be transferred out, or you may need to find another job. However, if you choose to leave, ensure that your exit interview says exactly why you're leaving. Don't be afraid to say, and it's not last lick. It is just the truth, because people, maybe when you go to another job and they're asking your last employer why you left, it can be looked at to say that you were competent in your function. However, the atmosphere in the workplace was such that you were uncomfortable and you were bullied and you had to find other employment. And of course, bullying can cause suicide. Many persons have been bullied to the point that they have decided to take their own lives. Bullied employees generally report that they are more stressed, that they have less job commitment, they have higher levels of anger, they are more anxious. And of course, people who are sexually harassed have less of those issues than people who are bullied. And people would think that would have been the other way around. So people who are bullied have more psychological impact than persons who are sexually harassed in the workplace. I'm not saying this for you to go now and sexually harass people, because it is less invasive and it causes less emotional damage than bullying. I'm not saying that. So please, people, don't go out there sexually harass your colleagues. All right? So don't switch from bullying and go to sexual harassment. So bullying, again, and its impact on team members and the witnesses. Of course, the other members or observers in the office will shut down. Of course, they shut down because they are afraid. They're afraid that the bully will take them out. They will isolate themselves, of course, because they also believe that if they stay away from the bully or the person being bullied, the bully will not find them to target them. They might also align with the bully, because if I align with you, you won't bully me because we're friends. Or these same observers may also side with the bully and start acting aggressively towards the person who is being bullied. We ask the employer to offer healthcare support. So if the worker wants a mental health day or they want a referral to speak with a psychiatrist, a psychologist, and the office, the workplace can afford to pay for it, please do so. If you can't afford to pay for it, but you can give the worker the time off to go and get the medical attention, please. That is some form of support. So please offer it to the employer so that they can get themselves managed properly. They can also provide training on how persons should behave in the workspace and how not to bully colleagues. Employees can also participate by helping persons who are bullied to recover from the disruptive behavior that they have experienced or witnessed. So, in order to have a bully-free workplace, we have to understand that co-workers, workers in the workplace must have respect. I don't have to like you to respect you. And I really don't even have to respect you. I can respect your position. And that is enough for us to not have a bullying workplace. So respect is seen as the antidote for bullying. So you develop a clear statement of the organization's values, including most prominently respect. So we need to just respect each other. Respect each other for who they are, respect each other for where they are, respect their space, and therefore you will not bully. A policy should be written, should be created, written, and communicated and shared with all member of staff that there is a zero tolerance anti-bullying prevention policy, and persons who are caught in violation of this policy will no longer be allowed to be a part of the team. Persons who want to speak about bullying that they have witnessed should feel free to do so. So employees or whistleblowers who have witnessed these things should have an area where they can speak freely about the bullying that they have witnessed. Every member of staff should know that if they are caught bullying, there would be consequences. And these consequences must be clearly communicated to everybody so that they know what to expect if they do not follow the company's policies. If incidents or when incidents of bullying is reported, it is expected that it be investigated in a timely manner so that they can be acted on swiftly. The anonymous 360 degree is similar to the whistleblower, where employees should feel free to report incidents. And of course, this can help them to help the other persons who are being bullied. Employees can also do onboarding, training, educating, marketing, or leading of employees. So during onboarding, the employee should be clear of what the employer wants. So the employer speaks when the new employer comes to the unit to work or the workplace, the hospital, it should be made clear to them on orientation that there is a non-bullying culture here and a non-bullying policy, and the policy should be communicated and a written copy handed to the new member of staff. Training. The anti-bullying component should be added to the other things that are in the in-service education packages that are used for training of staff. During the training, staff are taught how to identify the characteristics and behaviors of a bully, and the employer should, other than onboarding and educating about bullying, they should have a marketing campaign about bullying and the consequences of bullying for the bully as well as for the victim. And of course, the employer should lead by example. So they themselves should walk the talk, do not bully persons, so that your staff does not see you bullying and you serve as a positive role model for everybody else. Of course, victims admit that you are being bullied. You must seek support from your colleagues, friends, and family members. If you're being bullied, do not keep it to yourselves because of the consequences that we spoke of earlier. Get professional help as well as legal representation if you do need to take this to court and sue somebody. Get mental health counseling. Keep a diary, a detailed diary, so you write down the date and the time of the bullying activity and what was said or what was done. So you, if there are emails, you need to print and keep hard copies of these emails. So if you decide that you are going to confront, I don't want to use that word, it sounds a little confrontational. If you think you're going to meet with the bully, do not go alone. Have a witness go with you. Make sure that HR knows, so that HR can start their procedures that they have in place going. You're going to follow the policy and procedures that HR has in place. And of course, if you believe that you are unable to manage, know when it's time to move on. If the workplace is so toxic and the bullying is so strong that you're unable to cope, know when it's time to move on and do move on. So, this is a study that was done by Jackson and Ashley in 2005, and it speaks to the physical and psychological violence in Jamaica's health sector. People might say it is a long time ago, but I can assure you that the findings can very well be applied to today's workspace. So the objective of the study at the time was to determine the prevalence of experiences with physical violence and psychological violence that health staff have had in the workplace in Jamaica, as well as and to identify factors associated with those experiences of violence. Design method was that a total of 832 health staff answered the standardized questionnaire that was used in this cross-sectional study. Sampling was done at public health facilities, including specialist, tertiary, and secondary hospitals in the Kingston metropolitan area, general hospitals in rural areas, and primary care centers in urban and rural areas. Sampling was also done in private hospitals and private medical centers. And this, my colleagues, is of consequence because this study speaks to generalizability. Not only were public health facilities sampled, private hospitals were done as well. So the findings can be said to be applied to everybody. The results of the study spoke to psychological violence and that it was more prevalent than physical violence. Verbal abuse had been experienced in the year prior, which was 2004, by 38.6% of the respondents. Bullying was reported by 12.4% and physical violence by 7.7%. Of course, the older persons in the 40 to 54 age group, that's my age group, were the ones who were bullied most. So the young people bullying the older people. So look into yourselves, young people. As the study results said, the multivariate analysis showed that there was a lower risk of physical violence for health staff who were 55 years or older if they worked at night or they worked mostly with mentally disabled patients, geriatric patients, or HIV/AIDS patients. So the older people in this case were less likely to experience violence from these patients, but the younger ones, 54 and younger, who worked with these patients and worked during the day shift were more likely to experience physical violence. Staff members working mostly with psychiatric patients faced a higher risk of physical assault than did other health staff. And I'm sure my colleagues who work with psychiatric patients will say, yes, that's true. And nurses were the ones most likely to be verbally abused. That's you and I. So in conclusion, Jackson and Ashley concluded that violence in the health sector, the workplace in Jamaica, is an occupational hazard that is of public health concern. So evaluation of the environment that creates risk for violence is necessary to guide the formulation of meaningful interventions for the country. After looking at that study, I want some of us now to determine what is not workplace bullying, because some of the things that we looked at earlier, we thought, oh yes, but some of the things that you thought was workplace bullying maybe is not. So a strict supervisor. So if you keep coming to work late and a supervisor keep talking to you, if you keep wearing the wrong things, if you're not writing your notes properly, if you're not being kind to patients and you're being spoken to by your supervisor, that does not mean that you are being bullied. It means that you're being supervised closely. If you are not performing well enough and you are being spoken to about your poor work performance, then you are not being bullied. And remember, this is if you are really, really, in fact, performing poorly. Because remember, at a point, the bully would target the victim whether or not they were performing well. And even if they were performing well, they made them feel that they were not performing well. If you are not performing well and your supervisor decides that they're going to demote you, if they're going to discipline you, if they're going to counsel you or terminate you, then that is not workplace bullying. So there is another study that I want you to look at. This one was done by Dr. Lindo and others. This one is a newer study. This was done in 2012, and it speaks to strategies for the mitigation of workplace violence in a Jamaican hospital. Objectives at the time were to determine strategies to mitigate workplace violence in a Jamaican hospital through collaboration with hospital employees. 2 focus group studies were done of 22 members of staff representing 8 disciplines. One group consists of 8 female employees, while the other group had 8 female and 6 males. So one group was females only, other group was mixed. Each participant had been at the institution for more than 5 years. The discussions were facilitated by the same moderator, and a semi-structured guide was used to stimulate sharing of experiences with violence at work. The results showed that all staff had experienced workplace violence, with the accident and emergency and security staff at greater risk for physical violence. The nurses also were noted to be most likely to experience verbal violence than physical abuse. And patients were most likely to exhibit violent behaviors when they were waiting too long to be seen. Lack of understanding of medical jargon. So you're saying the things and they don't understand a thing what you're saying to them. The triage system as well. If they don't understand the triage system, if it's necessary to refer clients to the primary healthcare system, these are the things that sometimes result in violent behaviors among the patients. Underreporting of violent incidents was common, as invariably no action was taken. So I'm not going to report this because nobody's going to do anything about it. So strategies to mitigate violence included improved customer service, employment of additional staff to adequately deliver services, implementation of workplace violence policies, and educating the public on proper use of the healthcare system, thereby reducing crowding in the accident and emergency unit. It was concluded by Linda and her team that there's a need to raise the level of awareness regarding workplace violence among health sector workers in Jamaica, and workplace violence can be mitigated through education and by the implementation of multiple strategies using a collaborative approach among employees, health sector administration, and policymakers. So did you know that bullying is 4 times more prevalent than sexual harassment, and that bullying is responsible for 30 to 50% of all stress-related illnesses in the workplace? Also, bullies often don't know that they are a bully. So please tell them, Scott, maybe you're just enlightening them when you tell them, because oftentimes they don't know. Their behaviors are often based on prior role models. They don't know this either. Sometimes they see others bullying others and they don't realize it's bullying, so they copy the behavior, not knowing that it was in fact bullying. So, of course, bullies need education about how to motivate employees and deal with corrective action. And these are my few words, and I will take your questions after Mrs. Garrix Lloyd has done her presentation. Thank you very much.
Thank you, Mrs. Chisholm Ford. And I must say, it was a very comprehensive presentation. But we are just going to go straight into Mrs. Garrix Lloyd presentation, and then those persons who have question or remark or anything, at the end of the second presentation, you raise your hand and ask your questions. Okay, thank you.
Thank you very much, Mrs. Marshall Davis, Madam Chisholm Ford. Boy, I like how you just put that into the things that need to be addressed in this presentation. And I have a question you need to remind me at the end, how can I retroactively be compensated for previous bullying, right? So, good afternoon, colleagues. I am Cheryl Garrix Lloyd. As you may have heard, if you joined after the bio, Mrs. Chisholm Ford and I are double teaming today. So she talks about bullying in the workplace, and now I'm going to share with you about workplace wellness with a little bit of an emphasis on mental health in the workplace. So I'm going to start by asking persons. If anybody wants to share real quick with me, do you know what workplace wellness is? You're free to make up a quick definition, raise your hand and share with me, or do you want to just type it in the chat? Because one of the key questions we have to ask ourselves today is my workplace a workplace that facilitates, promotes, or enables wellness? So any volunteers to tell me what's their definition of workplace wellness, or if you have one, and or start typing it in the chat so that we're all on the same page. I have a definition for you, but just so that we're all on the same page. Anybody? So while you're typing, I I think Mrs. Chisholm would have said it. The educators in us will always come out with the objective. So we're going to have a couple of definitions we are going to look at today. We're going to look at some statistics. She had 2 studies there. I'm so very proud that they were both locally done. What are the statistics that highlights how we manage in the workplace and how does our health and our mental health affect us when our workplace is not about wellness, or how does our own health or mental health affect what we bring to the workplace? Why is it important that our workplace should help us to facilitate having mental health? What are some great wellness strategies? And then, of course, we're expecting you to be able to apply, to share, to plan, because the whole point is that we should have it, we may not have it, and if we do have it, we want to sustain it. So anybody typing in the chat, Mrs. Marshall Davis will check. So we have a definition here that we're going to share. So the definition of workplace wellness here tells us that workplace wellness is the programs that we have in place. They are usually long-term and they are supposed to reduce the benefit cost because they are improving our workforce health. So a lot of people tell you that without customers, you may not have any business. But I think Mr. Richard Branson said it, that the most important people in your organization are your employees. So some of the things that we look at in workplace wellness includes, do we have educational classes? Do we have any kind of fitness facilities that doesn't come at full cost? Are there policies to guide and promote healthy behavior? Are there other things, including environmental changes, that will overall affect the health of your employees in a positive manner? So think about it for a second. Are any of these things in your workplace? Because we're going to talk about that. All right? Just a reminder. So thank you, Barbara. She says that it's a place that fosters good mental health for workers. Wonderful. Do we have any of those places that we're aware of? Think about it so you can share with me in the chat. And so we will be able to highlight, because we need to highlight the good if we have it, you know. All right. So statistics, let's start with that. Biggest number you can see here. Of course, all the time America collects fantastic statistics, right? And we need some for ourselves. 55% receive health insurance. So we have that similarly as well here. But when we look at what we can do here, it says that if the health of your employee is poor, we're looking at 1, lost employee time. Their figures say that they have over 45 million people who are avoidably sick every year, avoidably. Revenue is lost. If you don't have your employees, then you're going to lose income. And then we have the strain from chronic conditions that get developed. And so 3/4 of the money that's spent from private insurance looks at dealing with chronic illnesses. It's simple. The employers can improve by having wellness programs. We have quality reports for our healthcare staff and the institutions in which we work. What kind of value-based benefit design are they implementing? Do we even look at that when we put into place what do we want from the facilities that we are employing persons in? And do they have a business health alliance? Is there anybody or any company who joins with another institution to ensure you're able to offer health benefits to your employees? The employees will save money. They won't lose as many days. They will have opportunity to have money for their care. They're healthier. Ultimately, we want healthier employees. The employees will also save some of their money because they don't need to be going to the doctor all the time. You are going to hear a little bit more about sometimes it's physical that it manifests when we are not okay mentally. And there is motivation so that we are looking at places of employment that considers us, that makes us know that we are valued and we are appreciated. So why do we want to have workplace wellness? The statistics again. Now, I would say the one that jumped out at me first was that there's 125% less likely for your employees to have burnout if we have a workplace wellness plan. 32% less likely to quit. I'm sure I heard Madam Sandra talking about high turnover. 46% less likely to experience unhealthy days. We don't want to have to just wake up today and say, my God, I wouldn't want to be at work, and you're calling sick although you're not sick. But it also means we are 29% more likely to be productive, 6 times more likely to be engaged, and 45% more likely to be satisfied as the employees. The top 4 reasons why this is now currently on the lips of everybody. Do we have a workplace wellness plan? Why do we need to have it? The absenteeism comes up as number 1, and the reduced healthcare cost. Because remember, for most insurance plans, your employer pays a percentage and you pay a percentage. So they're paying more. Number 2 is the reduction of stress and other mental health issues. Number 3 comes in with the ones just now before, the employee productivity and the morale. Who doesn't want to go to work? If you're going to work and every time you wake up, again, our previous presenter spoke about it, and your anxiety is elevated and you do not wish to be at work, we're having a real serious problem. And then, of course, we decrease the health risk among the employees, because that, again, we say we should be concerned about those who are bringing the business and being the face of our business. So we want to make sure they are healthy. So what does mental health at work look like? And I wanted to start with definitions, because when we say mental health, I'm going to be honest and say we're in a society where when you say mental health, people hear mental, they don't hear the health, and they assume automatically that you're talking about people who have mental illnesses. And I'm hoping that that's not any one of us, since we should know better. So I'm starting with the fact that we're going to become adults. You remember when you were younger and you were dying to grow up and leave your house because you want to be able to decide all the things for yourself? Nowadays, I see a meme that says it's a trick. Don't try to be in a hurry to be an adult. But when we get to being adults, we are finding ourselves employed. We have responsibilities. Everybody would like to have the perfect job. But if we were to do a survey, maybe there is no such job, but you want at least to be comfortable, to feel productive, and to feel satisfied. So we're going to have to work. It's going to play a huge role in our health and our welfare, because we spend a lot of time in these spaces that we work in. Financially, it helps us to manage. It gives us meaning and structure and purpose, because we want to be able to significantly and purposefully contribute. It gives us a sense of identity, builds our self-esteem. And of course, sometimes we get to socialize with the people we want to socialize with. Not everybody has to be friends, but at least it should be a social working environment. However, when our environment is not great, it has the opposite effect on us, takes a heavy toll on our emotional health, and just the way that our work impacts our mental health. Our mental health impacts what we bring to our jobs. So let's start with the definitions. WHO is our go-to in health, and it still applies no matter where we are or what business sector we're in. It is the state of well-being. When an individual realizes their own abilities, they can cope with the normal stresses of life. They are working productively and fruitfully, and they can contribute to their community. So WHO is telling us, if you're mentally healthy, you should be able to have all 4 of these, hopefully, or you could be able to see at least 2, and you may have to be working on 2. If you're not sure about any of them, then you also maybe need to work on how are we going to address that. So realizing your own ability, coping with the normal stresses, working productively and fruitfully, and contributing to your community. The National Institute of Health also says that mental health is emotional, psychological, and social well-being. It affects how we think, feel, act, make our choices, and relate to others. Please note that if you are mentally healthy, it's more than not having a mental illness. It is essential to our overall health and the quality of our life. Now, a mental illness or disorder is a behavioral or psychological syndrome or pattern. It also affects our thinking, feelings, and our mood, and it definitely affects somebody's ability to relate and function. Therefore, it means that when we look at mental health in the workplace, in truth and in fact, we should have policies to guide what if somebody has a diagnosed mental illness, and how are they being fostered to function at their optimal best. But for today, we're going to talk mostly about mental health and what we need to do and what can we expect from our employers, and why should we be the ones to be a part of what we may need if we don't have it. All right? So the risk factors for mental health for our workplaces. I'm sure the listing here is not exhaustible, and probably there's nothing on here that's a surprise to anybody. But some of the more common related work challenges that negatively impacts our mental health are our long hours. Sometimes the hours are inflexible, or short staffing, and maybe some of us in here can definitely relate to that. We can also relate to it in other sectors because nowadays all the banks are going cashless and less staff. And when you have to go to these places, it takes you the entire day. That affects your mental health, and the few people who are in there as well. Increasing workload. If you're short staff, it stands to reason that you're going to have more to do. If we are working remotely, as many of us experienced in COVID, and you have no separating between what is work time and what is work time at home and what is home time. We spoke about the bullying just now. So if we have a toxic workplace where bullying is the norm or there's harassment or abuse, it's a problem. If there is lack of training or guidance for any role that we are in, and we do not know what we were expected to do to fulfill that role, it takes a toll on us. When there is limited or very unclear communication from those who are supervising about the tasks, the goals, or the decision making, and definitely when we have lack of support, shortage of equipment, shortage of any resource we may need, and certainly when we have unsafe working practices. Because when we look at it, for instance, let me use the example of healthcare since we're all healthcare professionals. I would say to somebody, when you don't have what you need to dry your hands, it's very distressing to me because all of us in here know that hand washing is not complete if your hand is not dried. So it's a simple thing that people may not take that seriously, but it does impact on us. So the statistics again, over 71% of the persons in the last 12 months from this survey said that they experienced stress. 11% of those, it wasn't just the bullying, it was the overall challenges in the workplace, said they had thoughts and feelings of suicide at work. And then 73% would have said that these mental issues affected their work. They had to take time off, the quality of work was decreasing, and there was an issue with socialization with their colleagues. So let's talk a little bit about these 9 toxic workplace behaviors that we normalize that affects our mental health. Expecting to be able to work 24/7s. So I'd say also in the advent of cell phones and being able to have emails and or other things that we use for work on our devices, and we seem to have become slaves to the phones, So sometimes 24/7 work is not physical work. As soon as the phone pings, even if it's something work related, many people are inclined to check it and to seem to be available, and or your employers expect you to be available all the time. The micromanagement. We delegate, we have tasks, we have goals. Sometimes the micromanagement, nobody wants to have somebody standing over their shoulders all the time. And then, of course, you are still micromanaging when you're changing what they need to do, determining that they're not doing it well, and then you're also watching the time in which they're asked to complete the task. Overtime work. Again, sometimes overtime is being used like punishment and or it becomes the norm. Everybody knows you have to do some overtime, but why do you need to do some overtime? And there are some positions that people do not get paid for when they do the overtime. Response time. Expecting you when you say something needs to be done as the employee to be able to stop what you're doing and get it done right now. That's not feasible either because when you prioritize, as nurses, we use, for instance, the nursing process. We assess and then we are planning, we're implementing. It depends on what you have to do. You are not able to stop what you're doing and address whatever this is. And as my colleague likes to say sometimes, that your urgency is not my emergency. So if it's urgent to you and you're just telling it to me at the last minute, I can't drop everything I'm doing to facilitate that. Working long hours without breaks, normalizing that. Whole day, we haven't eaten, we haven't used the bathroom, and we're just going, going, going. In fact, a lot of us are now using screens, and we have not even done what we call the 20/20 rule, which is to look away from the screen for 20 seconds. Gender stereotyping is still an issue that's out there, and we'll talk about breaking the glass ceiling and or being overlooked because of your gender or because women have children that they need to consider for childcare and things like that. And then we're looking at more and more the benefits of employees being replaced or substituted. Sometimes it's pointless perks. There are so many jokes on the internet about when nurses are getting recognized, especially overseas, and all they get is pizza. And or nowadays in many workplaces, full-time employees are no longer, and all it is about contracts because contracts means that some of the benefits, if not all, are not available to a contracted employee. The results are a problem that we normalize. What it takes for us to get the results done is so hard and impacts on our mental health. But when the results are ready, nobody talks about the journey to get the results. We only want to highlight the results, and we expect the outcomes and the results no matter what we are short of. And then the busyness. If you are not looking busy, being busy, or very busy, then we're having a challenge because everybody assumes you're not performing if you don't appear to be busy all the time. It is not possible to be busy all the time. These are just 9 that were named out. I'm sure if I ask you right now, you can type in the chat, what other toxic behavior in the workplace you're in do we need to stop normalizing? So just type that in the chat and I'll come back to it. So what do we look at to determine if you're really not doing well mentally at work? Again, nothing I share is exhaustive. There are always other examples, but I thought we'd look at maybe some of the more common ones. So the work performance goes down. We're struggling to perform in our daily duties as well. And as we would say, sometimes we get an air of nonchalance. You know it needs to be done. You probably make a to-do list, but somehow your inner drive and motivation is completely gone. Takes you longer to get done. The quality of it is less, and you're realizing that this is not you. Sometimes others are also realizing that's not you. Trouble concentrating and thinking. If we are feeling exhausted, we are feeling fatigued, we are feeling overwhelmed, then we're not necessarily focusing on the task and the things that we have to do. It's sometimes our memory that's affected. We're not being able to think and focus and concentrate. It's kind of like I would say to my students, you have something to study and you're tired and you're still attempting to do it, but you read the one thing like 10 times, it makes no sense. You start finding yourself feeling like that throughout your work day. And you even sometimes realize there are changes to your speech pattern. So you were thinking through something and you're expressing it, and then you're having a challenge with being able to express what you're thinking. Your appetite changes, your sleep patterns change. There are two things that happen to us when we start to have an issue with mental health. We either start to sleep too much so that we don't need to think about what our challenges are, or we have an issue with sleeping, so we develop insomnia or somnolence. So with insomnia, you're finding that insomnia is different. You may either not be able to fall asleep initially, you may fall asleep but not stay asleep, or you may fall asleep and find yourself waking up in the early hours and you're not able to go back to sleep, and or you may not fall asleep at all. You're lying there and counting the ticking on the clock as the hours go by. The same principle applies to our appetites. We stress eat. And I'll tell you this, stress eating doesn't involve rice cakes and celery sticks and carrot sticks. Stress eating is about the comfort food that makes us feel better. And or we lose our appetites altogether and find ourselves sometimes eating because we need to eat or not eating at all. It also says sometimes people are now relying on other things that are their mechanisms for coping, including drugs and alcohol. Then our mood changes. We're not so social. We're not so talkative. We're not interacting. The hopeless, helpless feeling. We're feeling like we're on edge all the time or feeling worried. Or in Jamaica, we love to say people moody. But sometimes what we're realizing here is that people start to have uncharacteristic mood swings. So it's not that this person is somebody would have classified as moody before, but you're realizing that they seem to be okay, then they're not seeming to be okay, and we're not sure what's happening. And then some people, as we had said earlier, actually start to have suicidal thoughts. No interest in the activities. So you're not interested in the things at work, really. But you also find that the things you used to do for fun, you're losing interest in that. You're also not trying to be engaged with your friends. So I'd say, for instance, if somebody loves to talk to you all the time and you're checking with each other, and you find that when you message now, the person takes a long time to respond or they don't. If you say, come, let's go and do something, and they normally jump at the chance, but you find yourself not interested, or your person who you're messaging is not interested, then we're finding out that you're having apathy and you're losing your interest. So not even the things that would make you happy. Sometimes we're developing unnecessary fear or nervousness. We start to get paranoid about everybody at work and what's their agenda. We start to feel socially anxious because we have to come to work and work with somebody, but we don't necessarily have to socialize with them. And then we start to think about all the what ifs, that sometimes there is no basis for the what if. Increased sensitivity. Sometimes it has to do with a physical increased sensitivity, the sights, the sounds, and we're trying to avoid any kind of situation that may be overstimulating. So for instance, you work someplace where there must be meetings and there must be sessions that you have to come to and maybe debriefing and some of these other things, and you find that sometimes you're trying to avoid it. So there are 4 meetings for the week and you're trying not to be at any, or maybe one. And then sometimes people start to have unusual behaviors. So you start to get disconnected from everything. What's happening is that in your mind, when you're not mentally healthy, you are finding a way to cope. And what it's exhibiting as for those of us who are seeing you and hearing you is that your behavior has changed. It's unusual, not characteristic of you, or it's actually out of control because you are in an alternate reality where you are trying to be fine mentally. But what we are seeing is that you are definitely not okay. And then remember, I told you earlier, sometimes when we are mentally unhealthy, all it manifests as is physical aches and pains. Can't explain it. Go to the doctor to check it out, take medication for it. It may resolve temporarily, keeps coming back. And sometimes when you do all these tests, you don't actually find that there's anything happening to you. So now that we are realizing some of what's happening to us, now that we're thinking deeply about it, because I will share that this is a general presentation, but I know we're all healthcare professionals. They say we are the care in healthcare, but let's be realistic. Can you provide quality care if you're not caring for yourself? So you need to do something, but how are we going to address what needs to be done from a working point of view and in any institution or place that you work? So, oh, I'm sorry, that's the wrong one. So we are going to have to look at creating what's called a workplace model. How do we go about identifying? Now, does anybody want to tell me that you see 4 stages here? Do they look similar to anything that we are used to? Assessment, planning and management, implementation, and evaluation. Anybody open your microphones? What does it look like? Really quick, everybody should know the answer to this.
Nursing process.
The nursing process. Thank you. So the first thing is that we're going to have to assess. What do we have? Because we now are recognizing that there may be some factors at play. There may be some things that we need to address, but how do we do it from a general workplace point of view? So we're going to have to assess individually, who are the employees? What are the health risks? What services are there to be utilized or not? From an organizational assessment, what are the practices that they currently have that facilitates health and wellness? What about the actual work environment? What about the infrastructure? Again, I'll say, because we're healthcare professionals, if anybody never noticed, I noticed a long time ago that, for instance, the nursing rooms in hospitals seem to have been an afterthought, as opposed to being in the plan when we were creating these spaces. And then, of course, we're going to have to plan when we've assessed, because we're going to identify the challenges. We're going to work on our very smart outcomes. But in the planning and the management, we need to have teams. So we have some leadership support, because it must be that all of management is on board. Who are the role models? Who are the champions? What are some of the strategies that we've seen out there? Who is the person, if anybody? Because as far as I can tell, for instance, when it says management here, it says a workplace health coordinator. We probably don't have any such titles that we use sometimes to facilitate some of these things. What are the goals and the strategies we are going to use? And is there any resource available? Are we going to have to come up with some creative ways to get some resources? And then how do we communicate all of what we're working on? Because guess what? In doing all of this, if we don't have the buy-in, we're going to have a problem. Plus, your employees will want to feel a part of it. And 2, they will want to feel that it's something that's been genuinely done. So when we've worked on all of this, then we're going to have to implement. What are the things that we had in the plan? Are we doing education? Are we doing counseling? Are we doing fun? Are we doing outside of work activities? Are we creating the policies to guide as well? Because we don't want to have each person create something and then we don't have any policy and procedure or any follow-up. What if the employees leave? Do we want the wellness model to leave with them? What are the benefits? What's the support we will get from the environment, including from top up, to ensure that this workplace health model will continue? And then we evaluate it. So we were talking about the fact that we have so many people who are absent because of the mental health stress that they're going under. When we put these measures in place, does it increase the presenteeism? Are we able to identify that, for instance, the employers say, you know, yes, we are paying less health insurance because not so much people are going out for healthcare from our employees? Are we looking at improved health outcomes for those who may have illnesses or disabilities? And are we able to recognize that our organization can now be one of those places that people say, your workplace facilitates wellness? You should be able to say, yes, you know, NCB or UA Hospital and or UTech, should you be one of those examples that people will be able to highlight as a place that facilitates health? So this is the framework for workplace mental health. There are some components here, and there are 5, and we're looking at these 5 things. Protection from harm. Employers are supposed to protect us from toxic workplaces. So I'm sure, again, our first presenter talked about it. If your supervisor or the leader or the manager is a part of the toxic workplace, because she did say you should be able to report it, then we need to work on how we're going to get through from that, because you should feel safe in your workplace. And we want to ensure we're normalizing and supporting mental health. We need safety, we need security. As healthcare professionals, again, we're going to talk about Maslow's hierarchy of needs. There must be connection and community. Do we have social connection and community? Is there a culture of inclusion and collaboration? Do I feel socially supported? Do I feel like I belong, or do I just turn up and work here? There must be work-life harmony. So we need autonomy, how your work is done, but there must also be respectful employee boundaries. It cannot be that if you're working 9 to 5, when 5:30 and 6 o'clock, it's the norm to want to reach out and expect a response. We should matter at work. So there needs to be a culture of recognition, individual work within the organizational mission. And we want to also ensure that when there's team building, there is decision making. And you see the last one, because we all talk about that, a livable wage. We should matter. And even if we're not at the livable wage yet, and it's something being worked on, or we do have it, without the other things, we're still also going to have a problem. And there should be the opportunity for growth. Who wants to go to work all the time and feel like we're going in a hamster wheel going around and around and we're going nowhere? So we need to offer training and mentoring. We want to have clear, equitable pathways. We want useful, unbiased feedback. We want to have those PERs done. We want to see if I'm here for 3 years or 4 years or 5 years, what's my contribution worth and where do I see myself going? And how is it that it will tell you that I can grow, I can lead, and that I matter? So these are the 5 areas. This is what are the components of these 5 areas, and just a quick highlight of what do we need to make these feasible. So now we're going to talk about the 20 workplace wellness ideas. And remember, I did say the list isn't exhaustive. You have many, many more. So let's talk about the 20 you can see here, because we've talked about some of it already. The meditation and the yoga, if that's what you practice, we want some wellness expert partners. So for instance, I will say the JN group partners with Family Life Ministries. So the people who work at JN, if they're not doing well mentally, they're able to go in and have counseling, not at their cost. And I'm like, well, more companies need to start working on that. Flexible work schedules, resources, and newsletters sometimes just need to be kept up to date. We're going to talk a little bit more about the mental health support, the rewards and the recognition, but we don't just want somebody to say, oh, you're the employee of the quarter. What does that really mean? And wherein that shows my worth and my growth, not just a little picture, a poster, or a certificate somewhere. Is it something that's really saying that you value what I contribute? They put standing desks here because some of us have jobs that are sedentary. It's not good for our health. Hybrid working, and I would say I love this one. You know why? Because there were so many things we said couldn't be done before COVID, and in COVID, we got it done. Again, as healthcare workers, for those of us who are in clinical spaces, the hybrid working may not work so much. But we've also moved into, for instance, telehealth and telemedicine so that we are able to sometimes work remotely. The breaks that we need to take. Colleagues, they will tell us, take a break. A break doesn't always have to be 1 hour, but if you can take your 1 hour break, then take it. Sometimes you just need to stop. Sometimes you just need to close your eyes. Sometimes you just need to deep breathe. And when we take our day offs, make them count. Not the joke about when you say, on my day off, I'm going to do so and so. And you know what you do? Cover up under the sheet and sleep away the whole day. Sometimes that's what you need. But sometimes engage in activities that really refresh us. The insurance and the benefits, I have to say, We hope some companies are looking at this seriously because everything we do for healthcare, I always wonder, the people who don't have insurance, how do they manage? We're going to have to work on healthy work environments. We need some sports and some activities. You know what? Because when we say exercise, some people say, Lord Jesus, I say to somebody, nowadays, I don't say exercise, I say physical activity. So we need to implement a little bit of that. We can't leave out vaccinations and checkups because that's one way to keep us physically healthy. That also helps us to know that we are mentally healthy because even now, as you would say, for instance, in flu season, get your flu vaccine for argument's sake so that you don't necessarily need to worry about catching the flu that's going around because you don't necessarily want to be sick. And when you're sick, you're not mentally healthy. Nobody wants to be sick. We need some health groups to keep you healthy and to help you to work out if you have any particular diagnosis or disability. Group outings are important. Sometimes we want to do activities that have nothing to do with work. Do not let us gather all the time, and every time we gather, it's a meeting. Team building. Let us get to know each other a little more. We don't have to be friends, but guess what? We should know the strengths and the weaknesses of our professionals whom we work with and who we can rely on for certain things. The fitness challenge falls into the sports and wellness because physical activity releases endorphins. Endorphins are called the happy hormones. So the moment we're able to keep doing the physical activity, we are giving ourselves the opportunity to be better mentally. Volunteering. They say it is in giving that we receive. In any kind of volunteering, and we're able to give back and it impacts on somebody positively, we don't need to be explained about that. But just in case, come back tomorrow evening and you're going to hear a little bit more about why it's important to volunteer. And then the memberships, do you know that these are things we could give as part of the attractive rewards and recognition? And encourage them, and we could even have our own. And then we have already spoken about the boundaries that need to be set so that when we are at work, we're at work, and when we are not at work, we are not at work. But let's bring it a little bit closer to home. On the left of the screen, this was a suggestion I got from another colleague on something that they were doing in their institution to help to facilitate good mental health. So they had different activities that they planned out for different days of the week, and they worked out what they would have wanted it to look like. So there was buying and discussion on what we need to do. And then there was, let's get everybody on board and get their suggestions as well. Motivational Mondays. So let's get a jar or a basket or a something, and we're going to ask everybody, drop something motivational in here, and anybody who wants to just come in, pick it up, read it. Maybe it's something that you can do, but we're going to do that on Mondays. Training Tuesdays fit into the framework of the physical activity. So this is going to be something that we work on. Let's do a football competition and netball competition. Let's just do some exercise together. Some people need company to do the exercising. On a Wellness Wednesday, for instance, the ideas were, for instance, we're going to eat only fruit and water today as opposed to juice, or we're going to have a green or a salad to have for lunch, and everybody is a part of that. Talk Therapy Thursdays was something that was looking at meeting in groups and just being able to talk about the challenges, the suggestions, the recommendations. For us, I would say this could be a good idea because one of the things I've always said is, for instance, it's on the right-hand side. I find that when we are in our environment and we're having challenges and something happens that's traumatizing, especially for us as nurses, there's not always an opportunity to debrief. And we're not supposed to be sharing our clients' business. So who can we talk to? Yes? Fun Day Friday. Some people are working on that already. Today we're gonna all wear smiley face clothing. We are gonna wear Santa hats. We're gonna do something that's just about a fun day on a Friday. The step Saturday included the physical tying again, because we're gonna do the steps as opposed to the elevator, for instance. And then there was a selfish Sunday. Today was a day to do something that was personal and beneficial to just you. Other things that they brought closer to home, we need a space that's called a quiet room. You know, when you need to just deep breathe and relax, you need to just have 5 seconds for yourself of peace and quiet, then there's a room that you could go to use. It probably have a sign on there. So if you go down there and somebody's in it, you would know you have to wait till they're out. The debriefing sessions are important, especially depending on the pressures of the job you work in. Having a nice green space How many of us in our workplaces have a tree with some shade, maybe a little bit of flowers and a bench that you could go to that gives us the opportunity to inhale and exhale and look at nature's beauty? A personal gratitude jar, or even one for work. What are you grateful for at work? And if your gratitude jar for work not filling up, this is very serious. And then we did talk already about the social day out. When do we have an activity that's for socializing that has nothing to do with work? And then even closer to home, because we want our workplace to implement these things. We are going to be a part of the change we want, or sustaining any change that's being made. While they aren't doing that, there are a couple of things that we need to do for ourselves as well. The very first one I put here was self-care. We cannot pour from an empty cup. And it sounds good, but we need to practice it. And I always say, I had a little young lady who knows that she needed to eat, but was trying to get something done. And before she went to eat, she was really just trying to squeeze it in. And the next thing we know, it was the patient who was helping her because she fainted. We need to do self-care. What do you do for yourself every single day that improves on you and makes you your best you? Let's use some relaxation techniques. We talked about the deep breathing. Let's talk about guided imagery. Who knew if you, for instance, went in a quiet corner in the room, you can close your eyes and in your mind, you're gone to the beach. You can hear the water. You can see the person coming to bring you the pina colada that you want. And you can see your toes shaking and you're just having a little relaxed moment. The same principle applies for when we're not sleeping. You can close your eyes and picture nice and quiet or what works for you. It can be done anytime. We spoke about the endorphins that the physical activity releases, so we need to get in on that. Learn to say no. Work environments come with pressure. We all have tasks and chores. Does anybody in here, you can type it in the chat, you got to work and you had a to-do list that you wrote out, and then the next thing you know, you turn up at work and there's another to-do list at work that you never know anything about? Sometimes what's happening to us is that we have to learn to say no. It may take practice, but the more you say yes, is the less time you have to do the things that you need to do, and that puts mental strain on you. Everybody needs a little outdoor. Vitamin D is important. It helps us to feel good. The sunshine is important. Sometimes even like when rain or fall. Do you know that many of us when we were young, when it rained, we used to run outside and play in the rain and we were so happy. Think about it still, because there's a little child in all of us just the same. But what can we do outdoors that helps us to feel better mentally? What do we do for fun? When do we have fun activities, either planned or spontaneous? Do we manage our stress? And have we considered counseling? And I know that they say doctors and nurses make bad patients, but let's be realistic. How many of us get mad at our clients if they are not doing what they need to do? When our minds are not working the way they should because we are mentally stressed, then it means that sometimes we're not making the right choices. But if it's your mind you use to solve problems and your mind is what's not okay, then we need to get some professional help because that's their job. So nothing is wrong with trying for yourself. Nothing is changing it up. Nothing is wrong with giving it a longer time frame. But if we are trying everything and we feel like we are not really ourselves, because we did share earlier what the signs and the symptoms could look like, with the lack of concentration or the decrease in it and the work performance being affected and so on, then sometimes we have to try that professional. So I thought I would share this one with you because this is what I like to call the 335. And this one is free, can be used multiple times. And a lot of times when we are most overwhelmed, what we really need to do is to manage our breathing and relax ourselves, because it doesn't fix the problem. But when we have relaxed enough, it gives us a second to think about what can I do next? And that is very important. So you can have a quick look at it. The important parts. You have to inhale through your nose. You should hold that breath and you must exhale through your mouth. The inhale is shorter than the exhale because what you really want is to expel whatever it is that's happening in the moment. And we try to do it at least 3 times initially, and then it can be done any other amount of time you want to. So inhale through your nose, and we're not doing a 1, 2, 3. We're doing an inhale through your nose and count 1, 2, 3. You're holding that and you're counting 1, 2, 3. And then you exhale through your mouth and you count 1, 2, 3, 4, 5. So we can always come back to it. But out of the things we are saying, we are going to ask our workplace to get some of these things. We are going to be a part of the plan for this framework, for this health model, but we're also going to do some things within our sections that we are in, or even in our offices, in the group of company that we hang out with at work. And then we're going to do some things for ourselves too, because sometimes it does affect what you do at work when you're not mentally healthy. And sometimes what's affecting our mental health is not necessarily even work, or work is just a part of it. And so you are doing this as something to help you any amount of time you need it, as a part of what you're going to do for yourself. And this last one I have on here before we close off is I'm going to give you a little bit of time, because I want all of us to assess our well-being and where are we right now. There are 14 statements on here. Please let me know if you're not seeing it clearly. And it says 1, none of the time, 2, rarely, 3, some of the time, 4, often, 5, all of the time. In the last 2 to 4 weeks, I'm going to ask everybody to be honest and assess yourself. Answer each of these statements with a number. When you are done, then you total your number. Nobody needs to know your number but you. And I'm giving you like 5 minutes. And when you are done, I will tell you what is the meaning of the numbers that you will come up with. So I'm asking you, is anybody not seeing the screen to be able to see all of the statements? Or can you see them clearly? Seeing it clearly?
A little, could be a little
Yes,
bit.
Mrs. But I
Yes.
think for others, I don't know if you can, Mrs. Garrix
Large.
Lloyd, expand it just a little bit.
If I be able to make it just a little bigger? All
Yes,
right, let me see if I can do that.
Or we can zoom
Is that
in.
better?
much better.
Wonderful. So everybody gets 5 minutes. I'm going to be quiet. And I'm asking you to score yourself for all of these statements. And then you total your score. And then we're going to talk about what is the meaning behind the scores that you may be able to get from this. All right. So feel free to start. Assess yourself within the last 2 to 4 weeks.
Mrs. Garrix Lloyd, I'm not seeing the numbers, or what numbers do I use to score?
You're not seeing the numbers beside the statements?
No, I'm only seeing the statements.
Well, I'm not sure. Others are seeing this. So maybe you want to check your screen, because I'm not sure what's happening. The numbers are 1 to 5, 1 being none of the time, 2 being rarely, 3 being some of the time, 4 is often, and 5 is all of the time. And it's the same numbers for all the statements.
Okay, thank you.
All right. All right, so are we doing? Almost done?
Yes.
Don't start feeling distressed yet. Just put the answers and total it in honesty. All right, are we ready? Or the 5 minutes went too quick?
Ready?
All right. I will just give 1 more minute just in case anybody else was making sure that you've answered all of the statements for the last 2 to 4 weeks in honesty, and you are tallied your score so you will know where you fall when I tell you what's the interpretation. All right? So, oh Lord. So this is where we are. This is called the Warwick-Edinburgh Mental Wellbeing Scale. We are going to work on ourselves for our own mental health. We are going to be active and lobby and work on getting or maintaining any mental health activities or policies in our workplace. But I thought it would be good for us to close off with where am I actually right now in terms of my own mental health. All right. So I want to remind us that when I is replaced by we, and so in any place that we work, most times it's a we situation. Even illness becomes wellness. And what we really want to focus on is wellness. So we're talking about mental health or wellness in our workplaces. So I ask you these questions. Are you willing to advocate for yourself? Because sometimes you want something mental health in your workplace and you don't have it. Are you going to be willing to advocate for yourself? And if you don't have a wellness model in any way, shape, or form, are you going to be willing to advocate as well to get that wellness model started? So while you have totaled up your scores and you're going to work on where you are, you're worrying to hear what I'm going to say about the scores. Don't worry yet. There is one other thing I wanted to ask you to do for me today. There's a poll with 5 questions, 5 little questions before we get to the Q&A. And I tell you what the scores are, and I'm going to ask you to just go ahead and do that. For the persons on YouTube, my apologies. You will probably see the questions, and you won't be able to do the poll, but this is just 5 questions for you for mental health and the workplace. If you look at the bottom of your screen and you're not seeing the poll come up where you can click it, if you have 3 small dots, those ellipses right there, sometimes persons on their phones have to click on more or on the ellipses to be able to see the poll. So just 5 questions. You may go ahead and start your responses. All right, I see the answers coming in. All right. Go ahead and give me your answers. All right, I'm seeing some partially being answered. So is your workplace mentally healthy? There are some mental health initiatives at your workplace. Are you willing to volunteer to start the mental health initiative at your workplace? Does your workplace affect your mental health? And does your mental health impact on your workplace productivity? All right, so I thank those who are participating. It says there are 31 of us in here.
Sorry, the last 2, I haven't seen the last 2. I've only seen 3.
You should be able to scroll so you can see all of them. on your device?
I can't. Let me see.
For me, when I touch it, it's not responding to me. So
Oh.
I just the end of poll. I see
It's
them, I
not.
touch them, it's not responding.
Only seen 3.
Okay. Well, I'm not sure what's happening with that because you should be able to scroll on your device and see all of the 5 questions and move to them so you can respond.
I see them, but when I touch them, it's not responding.
All right. We have at least a half of the people answered. I give you just another minute so we can close off and then we can get into the Q&A section. All right. I thank you so much for the people who have answered. Let's just be realistic. Where are we? What are we offering? What do we need to do? Because we have to address the bullying, that some of the things we didn't know a while ago until Mrs. Chisholm-Ford shared. But apart from bullying, it says it was 30 to 50% of workplace stress. That means we have between 50 and 70 that we need to address as well. How are we going to get this mental health in our workplaces and ensure that we benefit as well as our colleagues, and therefore the clients that we serve will definitely benefit too. All right, so I have 19 people so far. Anybody else? I'm about to close the poll. All right. So, according to results of the poll, it says that first question, my workplace is mentally healthy. 58% said no, 26% said partially, and there actually was 16% of the persons who said yes, which is good because we need to have some, and we need to have some models that we're able to look at. There are some mental health initiatives at my workplace. 59% said no, but I'm happy that there was 41% who could have said we do actually have some. Am I willing to volunteer to start a mental health initiative at my workplace? And I had 6% saying no, but there was 53% saying yes, and the other 47 said, I will have to think about it. But we don't mind if you think, because it means you may be considering taking action. Does my workplace affect my mental health? 50% said yes, 38% said sometimes, only 13% said no, but I'm happy to have some no in here. And the last question says, my mental health impacts on my workplace productivity. 53% said yes, 33% said sometimes, 13% said no. So we are having a challenge and we have to work on it. And so I will close by reminding us that when the I is changed, we have illness changed to wellness because we're looking at we. And even if we start off by lobbying and thinking it's for us initially, individually, any workplace we are working in should have mental health activities, opportunities, should factoring the employee as being most important so we can ensure that those we serve will benefit. So for those of us who don't have any wellness or mental wellness at all initiatives in our workplaces, let us try to be a part of what we want. Let us share the message. Let us find those role models and those initiatives. In the Q&A section, I think I may have a little workbook. I will try to find it so I could maybe share it in the chat. But I just want to say thank you for listening. And so now that you have your scores ready, let me tell you, what is it that you are going to hear for your scores? So there were the statements made. You were answering either 1, 2, 3, 4, or 5. And so let me tell you what it says for you now. So if you scored between 59 and 70, congratulations, your well-being score is above the average and you are being encouraged to continue the things that you are doing. You're also being encouraged from me to share some of what you do for your mental well-being because somebody may benefit if you tell them what you're doing. If you score between 40 and 59, your well-being score is average, and pretty much many people who do this activity score between 41 and 59. It means that you are doing good, but there is room for improvement. If you scored between 32 and 40, your well-being score is below average, and you need to take some action to improve your well-being. And that action needs to start as soon as you can. However, if you scored below 32, then your well-being score is low, and you may need to start action right now, including speaking to somebody who is a mental health professional. So it's important for you to know where you're starting. That will be important to what you bring to work, how work affects you in addition to how you're feeling. And then we want you to walk away knowing that while you're working on yourself, you're going to work on it so that you are able to go to work and be in a good mental health working environment. We want the institutions to be places that we can highlight and say they have a good mental health policy and framework. Let's copy them. Thank you.
Thank you very much, Mrs.
Yes, very good.
Marix Lloyd. Well done, well put together as usual. And indeed, very interesting. And I believe you have been, I would use the word preaching mental health. And so I guess we need to have some converts by now. And of course, I am one of them. Right. So thank you. And Mrs. Chisholm Ford, thank you so much. As I said earlier, your presentation was so comprehensive. And the good thing about it is that it shows you all the aspect, financial out of the bullying, you see the financial impact, you see all the impact. And so well done, both of you. So I won't take up any more time because persons need to answer the questions, and so we can get going. All right, thank you very much again, my excellent presenters. So persons who, I turn it over to you now, Mrs. Eric Floyd and Mrs. Chisholm Ford, to take the questions from the persons who have questions.
All right. So if there's a question that can be typed in the chat, or if somebody wants to raise their hand, then we're good with that. If you only have a comment or a suggestion, we're good with that as well. So I will just wait to see if any hands are raised or any questions are typed in the chat. I'm sure I can speak on behalf of Mrs. Chisholm Ford. She's a part of my third, and people think we are twins. All right, so we're not seeing any hands, any comments. Are we to assume that we were as crystal clear, that you have had to pause and think about it? And or there may be nothing you want to ask us?
Persons may be contemplating as well.
Mrs. Wade's hand is up.
Good evening, everyone.
Good evening.
Thank you,
Good evening.
Good evening. Hi, Mrs. Marshall Davis. Good to see you.
Oh, thank you.
I just want to use this opportunity to commend my two colleagues on their excellent presentation. I did not expect anything less than what they delivered this afternoon. I must say, though, that Mrs. Chisholm Ford, I don't know if you are speaking, for want of a better phrase, the converted to those who are feeling the bullying, because many studies, and you rightly so presented two of them, that spoke to bullying in nursing in particular. And as you were speaking to mostly nurses here this afternoon, I think the presentation would have resonated with us. But I don't want us to always come back to these webinars and sessions and speak about bullying all over again. I want us to come to report about the changes that we have been seeing as it relates to bullying in the workplace, because it's impacting our nurses and it is going to impact patients and patient outcomes. And so I want to thank you for that. Mrs. Garrix Lloyd, that last bit of the information that you presented just now for us to score. When I started, I was happy that you reminded us that it was only for the past 2 weeks, because I found myself at times looking all the way back, you know, to events that would have, and I would have said, no, not often, but I have made a concerted effort and pledged to myself since the start of COVID that I was going to be focusing on me because, like you rightly said, you can't pour from an empty cup. And so I have been doing that in terms of engaging in self-care activity, ensuring that I'm, aware of what my mental health status is like. And I'm happy to have you in my corner, and Mrs. Chisholm Ford as the third, the three of us. Yes. And so I have been investing in my mental health and investing in my self-care because I found that I have just been going and going and going, and I've been using the opportunity as much as I can to preach to my students who I also teach, my master students who are already nurses, the importance of nurse leaders, ensuring that they are role models, not only in terms of what they do in the workplace, but how they also present themselves. Because if they are not taking care of their mental health, it's going to come across in many forms as possibly being uncaring, not being a compassionate leader, not being a transformational leader, not being one who is, taking care of themselves, and it is not going to be one that others may want to emulate. And so I want to thank you for that particular one. I am going to be sharing this scale that you just use as much as I can with others who are also interested in their mental status. And so for all of us who are here, and especially our nurse leaders here, if you're in charge of an organization, it's very important that we start our wellness seminars or wellness projects or wellness programs in our institution. So once again, I want to close by thanking you both for your excellent presentation as always. Thank you for the opportunity to speak.
You're very welcome, Madam Ovet. And if you need the scale, I will be able to send it to you. I have it as a
Appreciate it.
photograph, or I have it as a PDF and the
The
interpretation.
PDF would be good. Thank you so much. I
You're
appreciate it.
welcome. Marlies, I saw your hand. You took it down?
Yes, I took it down.
Okay. All right.
This Garrix, you could share that scale with me as well. Thank you.
All right. No problem. All right. Thank you, colleagues. I'm also looking at the comments in the chat. You are most welcome, and we thank you for joining us. The point of any of these sessions that we do from Omega Kappa is for knowledge and for sharing and for application, because we want to ensure we are taking it back and we are building on ourselves to build on what we offer. So we thank you. We thank those who are on YouTube as well. We know sometimes it gets a little delayed over there, but they're also listening in keenly. And we just want to double check if there are any last comments, if you have suggestions too, because remember, nothing we shared was the final thing. We take those two, and we are right here as we are going to wrap up. Just in case, I will hand back over to Mrs. Marshall Davis if she had a last couple of words for us. Mrs. Chisholm Ford, any last words? Sorry, ma'am.
No, Mrs. Garrix Lloyd, just for us to introspect, maybe, just to look at ourselves to see whether we are bullies or we are being bullied, and to take the advice in the PowerPoint and to speak out.
Thank you very much, Mrs. Chisholm Ford. So I need to say as well that based on Mrs. Chisholm Ford's presentation, when it speaks to the person, the type of, not just that persons in supervisory position are also bullied. And when she explained how bullying can be expressed, like undermining and so. So like Margaret, even at this point, once you have to deal with persons, you find that person still trying to bully you. So I'm thankful for this, and I will certainly take some of the cues and the solution. For the persons on YouTube and Zoom, thank you so much for sticking to it. I see we still have 33 persons. Thank you so much. And Omega Kappa, if you have interest, you can reach out to us. And I'm sure we have an email address, we have a YouTube, on the YouTube channel that you're on now, those who are on YouTube, and try to be a part of our membership. It is a very good chapter, and not just is it national, but also international. So thank you very much, each and everyone, and you all have a wonderful afternoon. And if you are still on the road. I pray you reach home safely. Those who are at home, find some time for rest. And the Lord bless you. Until we meet tomorrow, remember the last non-nursing presentation is tomorrow at the same time. Okay.
Andrea, I saw your hand. You took it down. You had a comment or a question?
If you could please repeat the key for the
Or
the
you want me to
mental.
tell you what the interpretation of the scores were?
Yes, please.
All right. So the interpretation of the scores are 59 to 70. It's good news, and it means that your score is above average. You are doing good things, and you should keep on doing those things. And I added a personal note. Please share with somebody else so that they will know what they can do as well. If you scored between 40 and 59, then your score is average. It means that you are doing good, but there is still room for improvement. If your score was between 32 and 40, then it's below average, and it means you need to take some actions right now to improve your mental well-being. And if your score is below 32, then it means that it's low, and you may not only need to take action now, you may also need to consider speaking to a mental health professional.
I
All
am
right?
finishing your young lady.
All
Yes,
right.
thank you.
So it means that
Thank
we
you.
are going to be looking at that, taking it away from us. We want to really thank you again, as Mrs. Marshall Davis said. If you want to find out a little bit more about us, just send us an email at the same one you registered from. You are also able to follow us, and you could message us on any of our social media if you're following us. We are Omega Kappa Chapter of Sigma, Facebook, Twitter, Instagram. Like and subscribe to our channel for any educational session that we do. We usually live stream and leave it there. So you can also tell people to go back and see the session. And our final day of this webinar series number 4 is tomorrow. See you at 4:30 as we close out the non-nursing. We're going to talk about volunteerism and its impact on you personally and professionally. And the last presentation of the series will be about creating multiple income streams. So have a very good night. Safe travels, as Mrs. Marshall Davis said, and see you all tomorrow. Thank you.
Thank you again, Mrs. Carrick Lloyd and Mrs. Chisholm,
Good
for all
night.
the persons. Blessings.
Thank you.
Bye.